Hi, I'm going to be talking about the drug Prosugrel and what I learned from my interview with the pharmacist today. And when I learned about it, it is an antiplatelet medication, and that's the class that it is in. So therefore, it is a blood thinner and deals with inhibiting blood clots and making sure that blood is able to flow through the body. And with that, it is typically used in unison with aspirin during percutaneous coronary intervention procedures. And before patients go through that, typically they're put on this medication. And some of the serious side effects can be like bleeding because you don't have clots to stop clots to form, so therefore the bleeding can be more severe. The most common side effect that's complained about is blurred vision or dizziness. And so found it very interesting that it did not have a lot of drug interactions to be worried about. According to my pharmacist, there was very little to be worried about, if any at all. And they usually did not have to give any like warnings as to, hey, don't take it with this, don't take it with that. It typically didn't interact with other things. The only concern that they had was if you're using multiple blood thinners, then it might cause extreme bleeding, and obviously that would not be a good thing. And so I think the biggest thing for this was just to use it as told. It's an oral supplement, and you take it whole. You don't swallow, you don't chew it, you don't split it up, you don't crush it up, anything like that. And it's relatively cheap with coupons, whereas without, it can be about $300. And it was very interesting and good to find out that it is covered by 90% of Medicaid and Medicare prescriptions, which is good because this is typically seen in older patients due to the nature of the surgery when it's dealing with heart stents and things like that after heart attacks, which typically happen the older you get. And so those are usually going to have Medicare and Medicaid prescriptions, and so therefore it's relatively cheap and or covered mostly by Medicare and Medicaid. And there wasn't really any special tips he could give me. It just kind of was pretty run of the mill, like specific to use. And one thing I did find interesting, however, is it has been discontinued in Canada. Although from some extra research I could find based off of what my pharmacist told me, that was more due to the company selling it in Canada didn't think it was wise to sell in order to make a profit. And so they discontinued it in Canada, but it's still available elsewhere. And it's a relatively common drug to be prescribed for these types of procedures and before these types of procedures, and most commonly is used with aspirin.